What is lupus and how does it affect you? Did you know that over 5 million people worldwide live with lupus? And here's the surprising part. Most of them look perfectly healthy on the outside. But behind the scenes? They're fighting an invisible war inside their own bodies. Today, I'm taking on a challenge to break down the truth about lupus and how it affects you in a way that's clear, honest, and easy to understand. And while I'll try to do it in 5 minutes, you just might want to stay with me a little longer. Because what you're about to hear might change how you see this misunderstood illness forever. Let's begin. Introduction. Lupus isn't contagious. It's not caused by a virus or a bacteria. It's not something you catch, and it's certainly not all in your head. Lupus is an autoimmune disease. That means your body's own immune system, the system meant to protect you, starts attacking healthy tissues by mistake. Imagine your body's defense team suddenly turning on your joints, your skin, even your kidneys. That's what lupus does. And that's why it's so important we talk about it, especially for those of us in our golden years. Presentation of the problem. Now, what does lupus actually feel like? Let me paint a picture. You wake up in the morning and feel like you've run a marathon before you've even had your coffee. Your fingers are stiff. Your back aches. There's a strange rash on your cheeks that wasn't there yesterday. You try to push through, but even walking to the mailbox leaves you breathless. So you go to the doctor. They tell you it's stress. You go again. They suggest arthritis. You go a third time. They send you for blood work. Weeks pass. You're still in pain. You still have no answers. This is the reality for many lupus patients. It often takes years to get a proper diagnosis. Years of doubt. Of being told it's just aging or just anxiety. Years of silently suffering. But lupus is not a one-size-fits-all condition. It doesn't play by the rules. Its symptoms come and go unpredictably, what we call flares. Some days you feel okay. Other days you're completely wiped out. This is what makes lupus so hard to understand and so easy to overlook. How lupus affects the body. Now let's take a deeper look at what's really happening inside the body. When you have lupus, your immune system starts producing something called autoantibodies. These are like overzealous security guards who can't tell the difference between friend and foe. Instead of targeting viruses or bacteria, they attack your own tissues, your skin, your organs, your joints. This can lead to inflammation, damage, and pain in almost every part of the body. And here's the thing, lupus isn't just one disease. There are several types. Systemic lupus erythematosus, or SLE, is the most common and the most serious. It can affect the heart, brain, lungs, kidneys, and more. Cutaneous lupus affects the skin, causing rashes and lesions. Drug-induced lupus is caused by certain medications, and thankfully, it usually goes away once the drug is stopped. Neonatal lupus is rare, but can affect newborns whose mothers have lupus antibodies. But no matter the type, the impact is real. Common symptoms include chronic fatigue, joint pain or swelling, skin rashes, especially a butterfly-shaped rash across the cheeks, sensitivity to sunlight, hair loss, chest pain when breathing deeply, mouth sores, memory issues or Lupus fog, and in more serious cases, Lupus can damage your kidneys, leading to Lupus nephritis. It can trigger seizures, strokes, and heart inflammation. It is, without exaggeration, a full-body disease. Personal story: meet Sarah. Now, let me introduce you to someone. Sarah is 43 years old. She's a mother, a school teacher, and, on most days, a fighter. Her journey with Lupus began quietly. She thought she had the flu, fatigue, fever, aching joints. But it lingered and worsened. She began to lose patches of her hair. Her face broke out in rashes. Then one day, her urine turned red. The diagnosis? Lupus. And Lupus nephritis, her kidneys were under attack. At first, she cried. A lot. She was terrified. She didn't know anyone else with Lupus. She thought her life was over. But slowly, Sarah found her strength. She began treatment, daily medication, monthly checkups, dietary changes. She started using sunscreen religiously. She wore compression gloves for her aching hands. She gave up teaching full-time, but began tutoring from home. And through it all, she refused to stay silent. Sarah became an advocate. She shared her story online, educating others. She joined a support group and made new friends who truly understood. And even on her worst days, she reminds herself, Lupus may have changed my life, but it doesn't get to steal it. That's the kind of courage Lupus requires every single day. Managing Lupus. So what can be done? While Lupus has no cure yet, it can be managed. Doctors typically prescribe medications like anti-inflammatories for joint pain, steroids to reduce immune activity, immunosuppressants to keep the immune system in check, and sometimes antimalarials, like hydroxychloroquine, which help manage flares. But managing Lupus isn't just about medication. It's about lifestyle. Here are a few critical tools in the Lupus management toolbox. Rest often because fatigue is a real enemy. Avoid direct sunlight. UV light can trigger flares. Eat a balanced diet to reduce inflammation and support overall health. Reduce stress. Easier said than done, but essential. Stay active, but pace yourself. Light exercise can help joints, but overdoing it can lead to flares. Track your symptoms. Write them down to help your doctor find patterns. And above all, stay connected. Find your tribe. Whether it's online or in person. You need people who understand what you're going through. Myth busting. Let's bust some common myths about Lupus. Myth 1: Lupus is rare. False. It affects 1.5 million people in the US alone. That's more than multiple sclerosis or muscular dystrophy. Myth 2. Only women get lupus. Also false. While 90% of patients are women, men, and children can get lupus too. Myth 3. Lupus just causes rashes. Nope. It can affect your organs, brain, lungs, and even blood cells. Myth 4. You don't look sick, so you must not be sick. That's the most harmful one of all. Just because you can't see it, doesn't mean it's not there. Let's stop treating lupus like a mystery. Let's treat it with respect and understanding. Special message for seniors. Now, if you're a senior watching this, I want you to know something important. Lupus can look different in older adults. You might already live with arthritis, or chronic fatigue, or memory changes. So when lupus appears, it can easily go unnoticed, or misdiagnosed. That's why advocating for yourself is so crucial. If your symptoms don't feel right, or if something new and unexplained keeps coming back, speak up. Ask your doctor, could it be autoimmune? Early diagnosis makes a world of difference. And remember, you are not being dramatic. You are being proactive. And you deserve answers. So let's recap what we've learned today. Lupus is a chronic autoimmune disease that causes the immune system to attack the body's own healthy tissues. It affects millions of people around the world, and it's often invisible to the eye. It can affect multiple organs, cause a wide range of debilitating symptoms, and take years to properly diagnose. There is no cure, but there is hope. With the right treatment, support system, and lifestyle adjustments, lupus can be managed. And for those living with it, your story matters. You are strong. You are not alone. If you've been affected by lupus, or know someone who has, drop a comment below and share your experience. You never know who it might help. And if you want to learn more about autoimmune diseases, don't miss my next video right here on Seniors Health Secrets. Because your health matters, and you deserve to understand it. Don't forget to subscribe, give this video a like, and tap that notification bell so you never miss a new episode. Until next time, stay informed, stay empowered, and take good care of yourself. Watch more of my videos and learn more about your health issues and how to fix them.